COVID-19 update with the Ministry of Health Executive Director, Ben Nangombe. A very good evening, Mr. Nangombe, and thank you so much for making the time to join us.
Good evening, NBC.
Yes, please proceed with your update.
Yes, tonight's update is as follows. We received 1,654 results from NIP, Pathcare, and Namibia laboratories, and 181 of these are positive for COVID-19. 97 of them are females, and 84 are males. The youngest is 1, while the oldest is 67 years old. Here are the details. Khomas region in Windhoek, 109 cases. Erongo region, 58 cases, 44 in Walvis Bay. Swakopmund has 13, and Arandes has 1. In Oshikoto region on Anjogwe district, there are 7 cases. In Zambezi region, Katima Mulilo, 3 cases. Oshana region at Oshakati, 2 cases. Umsati region, there are 2 cases at Utapi and 1 at Okahao. That gives us the total cases for this evening at 181. I want to give some details of the 7 cases at Onanjogwe district. They are a 38-year-old female from Onipa who has no known contact to a confirmed case. She was tested on the 10th of August, and she presented with COVID-19 symptoms. Second one is a 49-year-old female from Ondangwa who's a contact to a confirmed case in Oshakati, swabbed on the 11th of August, also presented with COVID-19 related symptoms. Third is a 21-year-old female from Onankali village in the contact to a case in Windhoek. Was swabbed on the 10th of August and also had COVID-19 symptoms. Then there is a 31-year-old female a 31-year-old male from Ondangwa in the contact to a case in Oshakati, was swabbed on the 11th, and he also had COVID-19 symptoms. The fifth is an 18-year-old female from Onipa, 18-year-old male from Onipa in the contact to a confirmed case in Oshakati and was swabbed on the 11th of August, also with COVID-19 symptoms. The sixth case is a 46-year-old male from Onaina with no known contact, and he was swabbed on the 7th of August as he had presented with symptoms. The seventh and last case at Onanjogwe is a 43-year-old male from Onaina with no known contact to a confirmed case. He had recently traveled from Windhoek, where he works. He was swabbed on the 10th as per request of his employer, and he also presented with symptoms. In Zambezi, the cases reported from Katima Mulilo are 3 health workers. One is a 41-year-old male, 2 are females aged 24, and the other is 28 years old. They were swabbed on the 14th, and 2 presented with COVID-19 cases. All of them had no history of contact with a positive case. The 2 cases reported from Oshakati are a 32-year-old female from Ondangwa with no known contact and no travel history. She was swabbed on the 11th of August and presented with symptoms. The other is a 70-year-old male resident of Oshakati West, no known contact to a confirmed case and no travel history, and he was swabbed on the 13th. He is admitted to hospital in a stable condition. The 2 cases at Otapi are a 54-year-old female whose contact to a known case. She was swabbed on the 10th and has no COVID-19 symptoms. Second one is a 35-year-old male health worker with no known contact to a confirmed case. He presented with COVID-19 symptoms at a local hospital, and he was swabbed on the 10th of August. The case from Okahau district is a 40-year-old female, a contact to a confirmed case, was swabbed on the 7th of August. It's important to note that among the cases reported today, 11 are health workers. 7 are from Windhoek, 3 are from Katimanlilo, and 1 is from Utapi. This brings the total of health workers infected with COVID in Namibia to 113, and they are both from public and private health facilities. We must point out that health workers are at a double high risk of getting infected, both in line of work and also in the community. Therefore, it is critical to continue to protect health workers, especially at the workplace. And we will continue to provide them, and we call on the private sector to do the same, to provide them with personal protective equipment that is appropriate, and also to reskill them on a regular basis on the correct use of PPEs through refresher courses. We report that among the cases reported in Windhoek today, 4 are persons working in the same hair salon. It's important to take note of places where transmission is likely to be high and to limit contact with such places as far as possible. In this regard, we call upon people working in hair salons and beauty salons to wear masks at all times. Fellow Namibians, we continue to record new recoveries. Today we report 10 recoveries, 6 from Comas and 4 from the Karas region. We also want to give some information regarding the condition of admitted COVID-19 patients in our health facilities. At present, 4 are critically sick. 1 is from Walvis Bay and 3 are from Windhoek. 14 are in a severely sick condition. 1 is from Walvis Bay and 13 are from Windhoek. And fellow Namibians, I'm constrained this evening to report 4 more COVID-related deaths in Namibia. 3 are from Windhoek and 1 is from Walvis Bay. They are a 49-year-old male from Windhoek who was swabbed on the 5th of August and was admitted to local hospital on the 12th of August. His condition deteriorated and he demised on the 13th of August. Another one is a 68-year-old female from Windhoek with multiple comorbidities who was swabbed on the 5th of August. She was admitted on the 6th and her condition gradually deteriorated, passing away on the 13th of August. Third is a 68-year-old male from Windhoek who presented to a local health facility on the 24th of July with symptoms consistent with COVID. He was admitted on the same day in a critical condition and was swabbed. He had multiple comorbidities and passed away on the 15th of August. The fourth is a 41-year-old male from Walvis Bay who presented to a local health facility on the 10th of August with symptoms consistent with COVID-19. He was admitted on the same day in a severely sick condition. He was swabbed on the same day, and he is also known to have had multiple comorbidities. His condition did not improve, and he passed away on the 13th of August. Hello, Namibians. I now want to present a summary of the cases of today. When we talk about the cumulative cases in Namibia currently, we are looking at a figure of 3,907. That is the total cases in Namibia, 3,907. The newly confirmed cases, as reported this evening, stand at 181. We have a growing number of recoveries, and they now stand at 2,352. That means we now have 1,523 active cases. 1,523 active cases. The total number of those that lost their lives related to COVID are now 35. And with increasing testing capacity, despite the challenges, we have to date tested 40,397 samples. The active contacts identified are 4,444. The cumulative number of people to have been in quarantine are 7,912. Number of people discharged from quarantine stand at 6,395, and the number of people currently in quarantine now stand at 1,517. So ends the update for this evening. I bid you all a good night.
Thank you so much, Mr. Nangombe. Well, there you have it. That was the Executive Director in the Ministry of Health, Mr. Ben Nangombe, giving us an update on the COVID situation in the country.